The COVID-19 second wave is detrimental compared to the first wave at the onset in early 2020. In the suburbs of Kampala, I went to visit a COVID-19 patient who has tested the wrath of the second wave of COVID-19. I will keep her profile anonymous and the voice as she shares her story.
Inside the house, I will make sure my mask stays on. Preferably, sometimes I even put on 2 masks inside the house because there are young children who forget to wear theirs. So I make sure at least I have double protection for their safety.
Katrina Cruz, not real names, is 35 years old, a mother of 2, and for weeks she is battling a deadly virus, COVID-19. It started as a normal flu and cough, but the situation got tense. Katrina went to hospital. Unfortunately, it was full.
And I had to make arrangements for me to find another hospital. Everywhere I would go, they would insist on me doing the test, so I just went for it, believing I was negative.
She is later told by the doctors that she has tested positive for COVID-19.
So I started looking back at the different changes that I had started experiencing. Then I was like, it is for real. COVID exists.
For only 2 days in the hospital, the bills multiplied to unreasonable sums. She was discharged, though still unwell, but told the contraction is mild. While at home, Katrina keeps her gloves and mask on as she interacts with her children.
They're also getting worried. The old one who can ask that, "Mommy, did you hang your mask near my masks?" That is how vigilant I've also become. I have to stay hand-gloved because I might use the phone and they need to play game. So they complain, "Hey, always we share the phone, how come?" But I have to make sure I'm hand-gloved, and then I tell them, "Have you sanitized the phone?" When I'm using the phone, I use it through the mask because I know they might get a hold of it without my knowing at some point. So we are together as a family, but there is that gap, we miss each other.
She is able to cook, but with precaution.
So this is the kind of food that this COVID-19 patient really does cook. It's sweet, and I think so soon my eating habits as well will kind of change.
I have to make sure I use the same water bottle. I have my water bottle, I have my juice bottle. I have my own plate. As soon as I finish using it, it has to be put where? It has to be washed with soap and water. I don't have to mix it with the rest. I have my personal cup, but this is specifically for my tea. I tell them don't share it.
Early morning, she wakes up to sunbathe, takes lots of acidic foods and hot drinks. Katrina steams daily for about 20 to 30 minutes. She does this 3 times in a day.
I will sweat and all the pores are open. You have to make sure your chest is open, your head is accessible, and your hands are also within your covering. So I will make sure I've steamed enough.
She does the same to her 2 children. The good news is that families are able to live with COVID-19 patients if discharged, following COVID-19 health guidelines. But how did Katrina contract the virus? Public transport, she narrates.
Because you would leave work in the evening, by the time you reach the taxi park, you have to fight for taxis and those coasters. So in the process, you're pushing each other to want to create space so that you find a way of entering yourself, and then they will take more than the required number because all of you want to get home, or at times even miss out. After fighting at the hustle, almost breaking your knees and your legs, you fail to enter. So everyone has touched you, everyone has been breathing so close to you, you miss out on that coaster or the taxi. So you sit back and wait. All of you are congested on the stage.
COVID-19 can attack anyone, regardless of the level of vigilance. It is therefore everyone's responsibility to save your neighbor's life. Katrina got her first jab of COVID-19, and at the time she contracted COVID-19, she was planning to take her second jab. Be responsible and follow the available preventive measures of COVID-19.